Guys, welcome back to my channel. My name is Midwife Jamie, a midwife, a mom, and someone who is super passionate about helping other moms have healthy, confident pregnancies. Today we are talking about something very important. First trimester safety tips. Let's get right into it. Whether it's your first baby or your fourth, that first trimester can feel overwhelming. But don't worry because I've got you covered. The first trimester of pregnancy is the first 12 weeks of your pregnancy and is a crucial time for you and the baby that is developing. It is a period of rapid growth and development. In fact, it is the laying of the foundation for the journey ahead. If you understand what to expect during this early and crucial stage, you will be able to have all the steps you need to ensure to have a healthy, less stressful, and a very successful pregnancy. If you are pregnant, congratulations. Let me see you in the comment sections. Let's see how far you are gone, and I would love to know that. Let's get into the safety tips right away. The first thing to talk about is healthy diet. Let's start with food because what you eat matters a lot during this time. During the first trimester, your baby's organs are developing, the lungs, the heart, and everything. And you need to fuel that development with nutrient-rich food. Make sure to include lots of fruits and vegetables like oranges, bananas, spinach, carrots, avocados, and mangoes because all of these are packed with vitamins like folate, vitamin C, and iron, right? And don't forget to choose whole grains like oats and brown rice, lean proteins like eggs and beans, and healthy fats like nuts or olive oil. All these foods I've mentioned are rich in nutrients which are needed for the proper development of your lovely baby, just to mention a few. Also, remember to drink plenty of water. Water is like they say. Drink at least 8 to 10 glasses. This will keep you well hydrated and help with digestion, circulation. It prevents headaches, fatigues, among others. Now, when I say 8 to 10 glasses, don't think of only water. Think of juices, milk, tea, and others as well. Now, let's talk about what you don't need to eat. You do not have to eat. Pregnancy has a way of weakening the immune system slightly, making both you and your baby more vulnerable to foodborne illnesses and harmful substances. So kindly stay away from raw or undercooked meat and eggs, and pasteurized milk or cheese, and high mercury fish like shark. If you eat these foods I have mentioned, you are exposing yourself to bacteria like Salmonella or E. coli or parasites like toxoplasma, which can cause infections, in fact, miscarriages, developmental problems, and even long-term harm. So mind what you eat at this stage. Let me put this quick question through. Have you had any pregnancy cravings yet? I would love to know what's been calling your name. Let me know in the comments. Now, the second thing is medications and supplements. Take all your prenatal vitamins as prescribed because they have a great potential to prevent birth defect and help the development of your baby. Please don't take any medications, even over the counter ones, without checking with your doctor or midwife first. It includes herbal teas, supplements, or pain reliefs. Please, some things you think are harmless can actually be very risky in early pregnancy. For example, avoid ibuprofen unless specifically recommended by your doctor. Stick to paracetamol if you need pain relief. And even that, use it sparingly. Don't make it your routine. It's also a great idea to keep a list of everything you are taking, including vitamins and, bringing it to your appointment so your midwife knows what you're taking. The third tip is lifestyle. Lifestyle choices matter so much at this stage of your pregnancy. This is the time you need to slow down and listen to your body. If you smoke, drink alcohol, or use recreational drugs, stop as early as possible. Seek help. Smoking reduces oxygen supply to your baby. Let me explain this. Nicotine narrows blood vessels, limiting oxygen and nutrient supply to the baby. This means that carbon monoxide will be on the increase and reduce the oxygen in your blood, hence your baby's blood too. This increases the risk of miscarriage, ectopic pregnancy, placental problems like placenta previa. This is where the placenta implants in the lower segment of the uterus, partially or completely over the cervix, or placenta abruption, which is early degeneration of the placenta from the uterine wall, which reduces supply of everything good to your baby. It can also lead to preterm birth. low birth weight, stillbirth, and it can leave a long-term effect that you would regret on the baby, which includes poor lung development, learning or behavioral problems, increased rates of sudden infant death syndrome. In fact, a whole lot. Seek help early so that you are able to leave smoking aside. Alcohol is not left out. Alcohol crosses the placenta. Your baby's liver isn't developed enough to, carry this stress from the alcohol. Even small amounts can cause a huge damage. Risk of miscarriage and stillbirth will be on the increase. It can cause fetal alcohol spectrum disorders, facial abnormalities, growth restriction, intellectual disability, speech and language delays, learning or behavioral issues. Hey, mama, it's not worth it. It's not worth it. Caffeine also should be limited to about 200 milligrams a day. That's just a little cup of coffee, or go decaf for peace of mind. Now, let's talk about exercises. Light exercise is actually good for you. Try walking, stretching, or even pregnancy yoga. Just avoid anything intense or high risk. And finally, get some rest as part of your exercise. Your body is working overtime. Sleep when you can. And don't be, afraid or guilty to nap during the day. I would love to hear your favorite way of relaxing these days. Is it walking, warm bath, or something else? Drop it in the comments. The fourth tip is just the warning signs. Even though most pregnancies go smoothly, it's good to know the warning signs. That means that you should call your midwife or doctor right away, like right there, right now. The first sign is if you get heavy bleeding or severe cramping. Bleeding and cramping in early pregnancy are not always dangerous. But when it's severe, in fact, the emphasis is on severe. When it's severe, grab your phone immediately because it can be a sign of miscarriage, ectopic pregnancy, or molar pregnancy. Other danger signs include high fever or chills, extreme nausea and vomiting, like you can't keep anything down at all, sudden dizziness or fainting, sharp pain in one side of your belly. Don't wait. Do you know why you should not wait? Early assessment with ultrasound or blood test helps diagnose the cause. Prompt care can prevent complication. See, even if it turns out to be nothing serious, it's better to be safe and reassured than sorry. So, mama, just to recap, eat well, rest, stay hydrated, move gently, and always ask questions. You are growing a whole human being, and that is incredible. Start a little pregnancy journal or download a tracking app, log in your symptoms, your mood, and baby updates. That can really help you. And it can make you feel more in control, and it's something you would treasure later on when your baby is here. If this video helped you, please give a thumbs up, subscribe, and share it with a friend or a mom to be. And don't forget to click the bell so you don't miss the next video. Until then, take care of yourself and your little one. You've got this. Thank you so much. I'll see you in my next video. Bye.